In contrast to the monopolistic structures of state-controlled healthcare, anarchists advocate for direct action and mutual aid as foundational elements of a community-based approach to healthcare. Anarchists assert that government-regulated healthcare systems are tools for the state to maintain control over its citizens. By centralizing healthcare, the state is empowered to dictate terms of care, thereby reinforcing social hierarchies and disparities. Government involvement in healthcare is inherently corrupted by private incentives and serves as a mechanism to maintain the state's authority. A surveillance culture which prioritizes monitoring public health for control purposes rather than for genuinely serving the needs of individuals. Anarchism postulates that individuals should have the autonomy to govern their own lives without interference from the state or other hierarchical structures. Such authority is not only unnecessary but is also harmful, as it often leads to inequality, oppression, and the erosion of personal freedoms. The state's involvement in healthcare creates inefficiencies and barriers that hinder access to medical services, stifle innovation, and contribute to escalating costs. At the core of the anarchist perspective on free market healthcare is the belief in self-determination. Anarchists advocate for the elimination of medical license requirements and the necessity for medical prescriptions. Empirical research supports the notion that onerous licensing requirements do not necessarily correlate with better care outcomes. In fact, studies show that states with fewer regulations offer comparable or even superior healthcare services while simultaneously promoting lower costs and greater accessibility. The barrier to entry posed by licensing can thwart innovation and the introduction of new care models, hindering the potential for more efficient, cost-effective care delivery systems. The removal of state-imposed medical licenses would empower individuals to seek out care from practitioners of their choosing, fostering a sense of personal responsibility and autonomy in health management. Patients should have the right to make informed decisions regarding their health care without governmental interference. Furthermore, the anarchist perspective stands in contrast to the capitalist model, where proprietary information is hoarded and capitalized. Anarchists believe that property is theft. As such, anarchists reject the notion of state-created intellectual property rights, including medical patents. Knowledge emerges from collective endeavors and therefore is a communal resource, not a private commodity. A model of healthcare devoid of special economic protection for intellectual rights would result in greater accessibility and equity. Prescription requirements not only create unnecessary obstacles to access, but also restrict patients' rights to choose their treatments. In an anarchist framework, individuals would have the freedom to obtain medications through the free market, without the need for permission slips from state-approved and controlled doctors, facilitating easier access to treatments and potentially lowering costs by removing intermediaries. By removing licensing barriers and prescription requirements, healthcare services would become more accessible, particularly for marginalized communities who experience systemic inequalities in the current system. A market-driven approach could allow for alternative care models, community clinics, and direct-to-consumer services, thereby expanding options for individuals in need of care. The abject failure of the American centralized healthcare system to meet the needs of the American people calls for community-run healthcare cooperatives, where knowledge is shared among practitioners and patients alike. These collectives could draw on shared knowledge to create treatment protocols that are locally tailored, minimizing costs while maximizing efficacy. The focus would shift from profit-driven motives to health outcomes, ensuring that all individuals have access to the care they need when they need it. The deregulation of healthcare would encourage the proliferation of alternative medical practices. By not interfering with practitioners' ability to offer services without the encumbrance of governmental regulatory measures, patients would have the option to explore alternative medical treatments that may not fit within the current medical paradigm. The absence of state-imposed regulations would lead to lower costs across the board. In a competitive market, prices would naturally adjust based on supply and demand, which would result in more affordable healthcare options for all. Additionally, providers would be incentivized to meet the needs of their patients effectively, lest they lose business to competitors. These initiatives not only address immediate healthcare needs, but also cultivate a sense of community empowerment, autonomy, self-governance, and collective action. An equitable healthcare system that is responsive to the needs of all rather than one that is dictated by the interests of a few.